It's IM time, and just like the other videos, I have introduced my patient, done the 6 strikes, like, everything I've ever done. So let's get down to business. Right here I have compazine. I'm going to insert into the vastus lateralis, which is in the leg. So I'm going to provide privacy for the patient. Curtains up, don't uncover anything. I don't have to. It'll be right here. Since this is an IM needle, it'll be a 20 to 22 gauge needle. There we go. This is for nausea, vomiting, anxiety, psychosis. Those are just some common. That's what it's used for. And before I would do this, I would just say like some side effects like blurred vision, dryness, constipation, and of course, right before I would clean off the area, I would clean off the injection site and then 2 inches around it, just because. And I might as well go ahead while I'm here, tell you how to find the spot. You would do about a hand's width above the knee and hand's width below, and just anywhere right here. You would want to put it in the side of the leg, not in the front. You don't want to hit the bone or anything, so you put it like right here, and that's how you would find the spot. It's easier when there's a mannequin. I mean, it's pretty easy, and this is probably the most common one. It's easy to find. More muscle there and everything. So let's just go ahead and do it. I found the spot. I'm going to go in at a 90 degree angle on the side pretty quickly because I want to like minimize the pain as much as possible. Inject the medication, come out, provide a band-aid. You don't want to, want to seem as confident or make as compassionate as possible. Be nice. Do the swoop method. There we go, we got that. And now we're going to inject the other one. So let's go to this side. And we're on this side. Right here I have Dextran. For this one we're going to use the Z-Track method. For this, it's for iron deficiency, stuff like that, 20 gauge needle. And so for the deltoid, what we would do here is find the acromion process. It'll be about right here, and then you want to spread the index finger with the middle finger apart, and you'll usually go right there. But for this one, we're going to use the Z-Track. And for the Z-Track, you're going to stretch out the skin. Oh goodness! You're going to be sure to remove like the shirt or any sleeves that would be on the patient. You're going to stretch out as far as you can. Stretch out as far as you can. And you got the needle right here. Insert the needle at a 90 degree angle. I've already found the spot. As quick as possible. Not too slow, not too fast. Pull out the needle and release. This will prevent discoloration, keeping the medication in the same spot. It's just very helpful for the patient. And while we're here, we might as well go ahead and bring up my beautiful assistant. Oh, I forgot to mention some adverse reactions like seizures, anaphylaxis, hypertension, nausea, stuff like that. I would have mentioned that to my patient beforehand. But we have my beautiful assistant here. For the ventrogluteal, what we're going to do is, I'm on her right side, so I'm going to take my left hand, find her greater trochanter. Boom, bada bing. I found it. I found it. And what we're going to do is go in between the index and the middle finger right here. Boom. You can also go like this and go right underneath it, which is about the same. Find the greater iliac crest, go underneath it, right there. Boom. I like the way I did it first the best. And for the second one, we're going to separate the buttocks into 4 quadrants. You're going to go in the top right interior corner. It's better to go further away. Don't hit the artery or anything. And I believe that's everything. And of course, before I would go, I would lower the bed into the lowest position possible, give them the call light, ask if he had any more questions. And if they didn't, I'd be sure to monitor Dextran really closely, and I would be on my way.